Yoo-hoo. Yoo-hoo. Welcome back, everyone, to our official Las Vegas Pride podcast. My name is Meliton. I know you are sick and tired of hearing about me, but that's okay because I'm not going anywhere for the next 2 years for sure. Just a little announcement before we start today's podcast. We are less than 100 days away from our parade and festivals, so make sure that you check out our website, lasvegaspride.org, so you can see all of the events what we are planning for you guys. I promise you it's going to be amazing. You're going to love every second of it. And make sure that you are checking those prices because some of the prices for the parties are pre-sale deals. I'm talking to our manager here about this just to make sure that I get it right and you guys not going to come after me in online that I sell you some shit. So for today's episode, I have a really special guest here with me. Hello, Eric.
Hello.
How are you doing?
Good. Thank you for having me here.
Of course. We love having you here. I mean, like you are part of Pride for in and out for a long period of time.
Pride for life.
Pride for life, yeah. One way or another, you were part of Pride. If it's you or Kevin, through Kevin, you were part of this organization and the cause for a long period of time. So for the people who don't know about you, let's give them some introduction. We would like all of your achievements, your life story, your social security number, your feet size. I know after lots of conversations, so I know your husband, Kevin,
Yes.
who was our Mr. Las Vegas Pride 2020.
2022.
2022.
Seems like so long ago.
I know, it feels like forever. COVID kind of fucked us over, is it? And he told a lots of things about you for me. So I know you were in the military now.
Okay. So yeah, I did 20 years in the Air Force. I met Kevin when we were both actually in the service. We were stationed in North Carolina. And I met Kevin in 2014, and we dated for a while, and eventually he separated from the Army, and I was in the Air Force, and I got my final orders for my last duty assignment to Las Vegas, Nevada. Kevin was making a decision on what university he was going to attend. He was looking at some different universities in North Carolina, and I sweet-talked him into coming with me to Las Vegas. He's originally from Phoenix, so it was desert life. He's used to that. And I was like, hey, you want to keep this thing going and join me in Las Vegas for my last 4 years of the military? And here we are.
So we can be thankful for you that Kevin stayed here. I'm hearing that one from you.
Yeah, he joined me. And shortly after that, we got married in 2019. And in 2021, I retired from the Air Force. So I did 20 years.
By the way, thank you for your service. Every person who was in the military, we support you here in Las Vegas Pride, of course. And I know that under your service, you guys were under the don't ask, don't tell.
Don't ask, don't tell. So
area of military.
So I served 16 of those 20 years closeted, very carefully serving under don't ask, don't tell. When I enlisted in 2001, at that time, the military definitely was still doing investigations. They would investigate service members after hours, after duty hours, to see where they're at, who they're hanging out with, just to try to get something on them, to build a case against them. If you acted out in any way or disclosed that you were LGBT, that was you could have been discharged dishonorably, or you could have lost all your benefits.
I heard this story a lot from multiple people, and it's honestly for me it's shocking that this still happened, and it's shocking that I feel like we are going back to that version. Like how we are treating right now with the transgender people and the military are heading back to the same direction under this administration. And I think we really need to be careful because if it's a slippery slope situation, like now we don't have the don't ask, don't tell, but it can be reenacted back to the military because that's what they're trying to do. They tell that transgender people shouldn't be there first. Once we're attacking a minority of the minority group that is 2 seconds away from actually taking away, go back to the awful way of how it was before under those rules.
Yeah.
Yeah, so some of those laws what now this administration are trying to do are pretty much one step away from going back to this don't ask, don't tell area of military. And I think it's very dangerous because we can go back in like 2 seconds to that. So I'm sure you have some thoughts about that.
I do. It's almost like whiplash because my last 4 years in the military were spent in Nevada. I was stationed up at Creech Air Force Base in Indian Springs, and I was going to a special unit, a small unit, and it was at that first meeting with my first sergeant that I actually, for the first time in my career, felt comfortable disclosing who I am. I wanted them to know that I wasn't single. I had somebody that I was seeing that was with me, living with me, that I loved. Because before that, I would either lie about a significant other or constantly be single. And then people would start to wonder, like, hey,
yeah, what's happening here?
You never talk about something, or you never bring your girlfriend around, or this, that, and the other. And you can imagine after 16 years of living closeted, coming up with a lot of stories and living a double life, it wears on you mentally.
Yeah.
So my first sergeant at the time in 2016 talked to me, and I actually felt comfortable, and I knew this was my last 4 years. By that point, Don't Ask, Don't Tell was repealed during the Obama administration, and I remained closeted for years after that because I still didn't trust the system.
Yeah.
But when I came out, he reassured me that there were others in the squadron who were also in the community, and that I had the utmost support and respect from the leadership. And my 4 years at that station, I felt it. It felt like I was part of the family, part of the team. Kevin came to some of the squadron functions, like the Christmas party or the picnics, when we had downtime, and everybody treated him great. And so it was really just a great feeling, and total night and day from where it was just 15 years earlier. But after retirement, I saw things start to get to progress. I start to see that diversity became more highlighted in the service, and people were acknowledged, different people, and celebrated. And then in the past couple of years, I've seen that all go away. Yeah. So, like you said,
it's a slippery slope.
It's a slippery slope, and we have to be engaged if we want to continue to progress.
And I'm sure all of this experience really helped. I'm shaping you in a way that I know you've been doing a lot of community work. So I know you were part of Lambda here in town for how many years?
5 years. So I joined Lambda Business Association. While I was still active duty, I started a small business here in Las Vegas. It was called Mobile Medics CPR Training. So I am an American Heart Association CPR trainer. I started the small business, and in doing so, I wanted to find a chamber of commerce or business association where I could network and meet other LGBTQ plus business owners or allies. Mm-hmm. And so quickly found Lambda. I joined, and I served on the board for 5 years. That was my introduction to the community, and the monthly luncheons happen at the LGBTQ Center downtown. Yep. So I got to know the center pretty well as well. I decided to step down from my role as a board member when last year, 2025, I decided to go back to school for my master's degree in public health. And so this is where I'm at today. I'm still pursuing that. I just got over that halfway hump. As you know, you're also getting your education.
Yeah, we are in the same school, just different areas.
I see Melatonin
sometimes on the campus. Yeah. You are more of the hard part of it. I'm on the boring part. I'm a liberal, so it can be really boring. But yeah, I see your campus, and that's amazing. So everybody who is listening, education, it's important. So make sure that you get your education. Don't worry. We both are older students. So if you didn't find your passion in 21, 25 years old, you can find it whenever.
It's true.
And it's never too late to go back to school and do whatever you want to do. Nobody's going to stop you. Trust me. And actually, professor's going to love you more.
Exactly.
I'm sure you can speak to that.
If you're an older student returning, you bring your experience, your life experience, your job experience, and you can share that with the younger students. I think it's appreciated.
Yeah, and students appreciating, professors appreciating. I think it's a more interesting conversation during class. So that's amazing. I know you work really hard on your degree. So, by the way, my hat's down for you.
Likewise.
But I'm only doing my undergraduate. You're doing your master degree. There's a difference between it.
Still pursuing your goals.
And I know you're doing your internship right now with
Yes.
the center.
Since I started my MPH program, I became a graduate research assistant for the Rainbows of Aging team. And this is a research team that works under Dr. Jace Flatt at UNLV. And we focus on research having to do with LGBTQ plus seniors have around brain health. We look at Alzheimer's, Parkinson's disease, and what's been identified through research is that the specific community, the LGBTQIA plus community, lacks data and evidence in research that exists today. It's mostly heteronormative. And so a lot of what we do is specific to the LGBTQIA community. Yeah, we want to be reflected and represented in research.
And because I don't know too much about it, so I'm just going to have a couple of questions about it. What would you say like is the major difference between like an hetero version of brain health?
Sure.
Or the LGBTQIA version of this? Like the treatments or the center of where people can go for, or what are the big differences here?
Okay, it's just some major differences. First of all, we share a lot of the same issues as far as mental health and physical health issues. Sure, we share a lot of that. But when we look at our community, specifically the LGBTQIA plus community, there tends to be accelerated illness, specifically with brain health. And that's caused by increased mental distress, minority stress that happens over time. When we look at our senior population, you think about the Stonewall generation. So they had to
go through a lot.
They, started a movement, and it's because of that movement that we are allowed to enjoy the benefits that we have being out. But that came with a lot of stress, and some folks never came out of the closet. Certain parts of the country, it's not safe. So that follows along when it comes to medical care. They might not feel comfortable disclosing things to their healthcare provider. They might carry stigma along with them, fear. I know, thinking back on my own experience in the military, there was always fear of reprisal, getting outed. Today, I'm enjoying my education because I have the benefits, the GI Bill. If I was outed and I was discharged dishonorably, I might not have that benefit or the medical benefits. So that's to answer your question. Illness is accelerated through minority stress, and we want to look at specifics when it comes to the LGBTQ plus community so that we can identify things. And then once you have this information, you can implement recommendations going forward and implement policies that better care for us.
Better care. And that's one thing for a person who is not studying this or not really well known for these areas of LGBTQI plus community. It's very interesting to hear that because we all know that our older generation in this community went through a lot of stress. And some of the current population of LGBTQI plus people still have a really stressful life because of their sexuality. And, when lawmakers make laws and they are playing around with our rights, I don't think it's ever really been bring up to the conversation that maybe that's not good for the health of the individual. They're just talking about, well, that's okay. I mean, like, they have whatever they need. Like, why are they need to get married? That's between straight people, but it's stupid. But all of that, the conversation never goes down to mental health. It never goes down to actually physical health, because some people say, yeah, depression, this and that, but that can lead into really serious,
for sure,
side effects, what you just mentioned. And it's really interesting for me to hear that. Yeah, I think what you're doing, it's amazing, because we do need to take care of our older generation who for the way out where we are right now. And we need to do much as we can as the community, and not the people like you, me, and younger generation who have all the rights because of them, to go back and see, what we can do for those older generation to make their senior life
exactly
the best years of their life.
Yeah, just improve overall health and wellness.
Yes,
healthcare, caregiving. One of the most recent studies that I've been a part of, and doing surveys with participants, was the Stonewall Generation study, and we just wrapped that up this past spring. And I'm excited to see the published papers that we produce from that information. But in doing that work, I got to speak with probably over 50 or 60 LGBTQIA plus seniors and some heterosexual seniors as well. So what we do is we looked at both, and we used our hetero seniors as kind of control, and so we could see the differences in the questions and different subjects. But my point is this: it was really interesting to hear the stories of the seniors themselves. It gave me much respect for them, and it also made me reflect on my own experience back when I was closeted. So it was a really heartfelt experience. So I'm really happy to be doing what I'm doing.
Well, I'm sure we are super grateful what you're doing for sure as Pride. I'm super grateful for what you're doing as an immigrant gay person who understands what it means to be living in a stressful situation. And all of those people we know here in Pride, and I personally know all of those generation of Stonewall generations. I'm sure they are really grateful for all of the hard work what you're doing, and how this one is connecting with the center.
All right, so
let's go to the center part of this.
Yeah, so as part of my MPH program, there's an internship that's required, and typically folks do the internship the second half of their program, and I knew about it from day one of my education. I'm like, okay, internship, and I'm already thinking about where do I want to work at, and there's so many different places in Vegas Valley that are internship sites, and immediately I thought of the center because my degree is a master's in public health with a specific focus on social behavioral health. And this center really embodies social behavioral health in everything that they do, from all the programs that they run to the services that they offer the community. And even since I started my internship with the center this summer, I'm coming up on my final couple weeks as we have an event coming up. But it's really opened my eyes to see how extensive the programming and services that they actually offer. I've been a Vegas resident for about 10 years now, and I've gone to the center for events and luncheons and volunteer opportunities. But this experience has really opened my eyes to everything that's going on over there. It's a lot, and it kind of makes me proud of what's happening over there.
If you just would like to share it with us, especially with me too, like what would you say those main things what they're doing, what you just mentioned?
Okay, so I can share with what I've gotten exposed to. So when I started the internship, I'm kind of I work under the HIV, the clinical side over at the Arlene Cooper Healthcare. And so I got to see that side of the house where they provide sexual health advocacy, testing, screening, preventative care. And then I got to come back and work with the folks that run Linkage to Care. So they provide resources to folks that are maybe unhoused within the community. They provide resources to folks who may have substance abuse issues, who may need services or may want to have other options of getting off a substance. And this program is just so awesome that what they provide the folks. And then I went over to the senior side. So I got to see the senior programming. The senior programming is called Act 3. And basically, there's something happening almost every day at the clinic. They have like game days, they have lunch and learns, they have programming in the evening, in the afternoon. But at first I got to sit in and kind of just watch. They play cards a lot, and I learned that I'm not so good at some of the card games that they play, but that's all right.
After that many years in Vegas, still not good?
Still not good. Yeah. Press your luck with the seniors, you're going to lose.
That's why I don't try.
But yeah, I got to interact with the seniors, and I was invited to do a presentation for them to tell them about the things that I've been working on with Rainbows of Aging. And a lot of those seniors have participated in studies that we've actually been doing in the past, so they were very familiar with it, and they were really excited to learn some of the details. Aside from that, I got to do a 40-hour training program that's called CAN. It's Center Advocacy Training, and that basically 40 hours of crisis training. And so any volunteers at the center are eligible to take this training. It is, if you get the opportunity, it is so thorough and just great training. I've had so much training in my military career, but this just added to that, and it was really impressive what they put on for the folks there. And then lastly, as part of the internship, I'm supposed to produce a product or a project. And so because I do my research with the senior community and I've been spending a lot of my time with Act 3, I decided to do a senior event, so a senior resource fair.
But you mentioned one thing, but I did wanted to ask you before about it too. What is Rainbow of Aging?
So Rainbows of Aging is a research team that works at UNLV, and we fall under the School of Public Health, and we're led by Dr. Jace Flatt. And so, like I said, we basically our studies revolve around LGBTQ seniors, brain health. Some of our studies have delved into Parkinson's disease, Alzheimer's, dementia.
All of the lovely conversations. They are the easiest conversations to have with a person.
Yeah, we've done a lot of outreach. I've gotten to go to different areas like Palm Springs, for example, where we have a very large population of our LGBTQ plus seniors in Palm Springs. So I've got to interact with seniors from different geographic locations. And it's been really, really eye-opening and rewarding just to learn from them, hearing their stories.
Yeah.
And they love to share.
I think the older generation love to share their stories. And it's amazing because we need to learn from those stories and do better in the future. And you said you're going to need it to do a project for this.
Yes.
So would you like to share it with us?
I would love to share it with you. I'm super excited to share. I have been working on, since day one of my internship, the project. So in addition to going to the different programs and shadowing the different services that happen at the center with the employees and learning from them, on the side, I've been coordinating a senior resource fair. So from the very get-go, with my preceptor at the center, we had to come up with a name. I didn't want to just generically call it, it's going to be a senior resource fair at the center. I wanted to put a little nice touch to it. So I came up with Thrive and Shine. So why did I choose that? Well, I think about the seniors that we're inviting to come participate. I want them to attend and I want them to thrive. In addition to the resource fair, my research team is sponsoring a portrait project. So it's called the Rainbows of Aging Portrait Project, and it will run alongside the senior fair, same date and same time. And what that is every senior who attends has the opportunity to get a free portrait of themselves. We'll have a professional photographer there, and they will be able to have something physical to take home with them, a nice portrait or a digital email. We could email them the photo. But that's where the shine comes in. So they're going to thrive. We want them to thrive in life. And it's a celebration. I want to let the senior see themselves in a beautiful light and see themselves shining. So in addition, this came from the idea in doing the research and marketing our studies. If you Google or look at stock photos online of LGBTQ plus seniors, the photos are all pretty much the same. There's like 4 or 5 photos, and they're not very diverse or representative of our community. Yeah. So we thought, why not, with consent, of course, invite actual seniors in our community to contribute to a media library that can be done up for them and could be used for research purposes or documentation. Yeah, just to have for them.
I love it.
So it's called the Thrive and Shine Senior Resource Fair, featuring the Rainbows of Aging Portrait Project. And this is happening Thursday, August 13th from 10 a.m. to 1 p.m. at the center. And if you don't know, I'm sure everybody knows where the center's at, but it's 401 South Maryland Parkway, downtown Las Vegas.
And is the participation, or like, do you need to RSVP, or is it free, walk in? Is there any ticket pricing? Or
it is free to attend. Everything is free, all the services we're providing, and we are asking that folks register RSVP. And there is a QR code and a link that we could put in the comment section of this post.
Or we just put the QR code here.
There's one more thing that I wanted to add to this before we get into the details.
Yeah.
So from the very beginning, I figured out the title. Okay, Thrive and Shine Senior Resource Fair. Good. Now, everything else you have to figure out. So who's going to come? Who do I invite to be a part of this event for our seniors? So basically I went directly to our community seniors to see what is their priority, what are their needs. And I did this by creating a survey, a needs assessment, and I was able to get 30 in-person surveys completed by the seniors that attend the programming at the center. And I was able to get additional 7, so 37, that folks completed the survey online. So with those 37 of our local seniors, LGBTQ plus seniors, they basically shined a light on what I need to do from there. And I used that assessment to guide every step of this process.
Mm-hmm.
And it actually surprised me, like some of the topics, you think healthcare, housing, mental health, financial. What do you think the number one priority was for our seniors?
That's I had no idea, so I really wanted to see.
I was actually surprised. I knew it would be up there, but I didn't realize it would be number one. It's social connection.
Guys, we need to do better. Get off your fucking phone. Go out and talk to people. Swear to God, each and every one of you who has listened to this podcast. My generation, we fucked up. I'm sorry. I'm sorry for the older generation if you listen to this. We fucked up with social media. We fucked up on Grindr. We fucked up on Sniffies. Can we get the fuck out from these phones and just talk to people? Would be really nice. I would appreciate it. Thank you so much for your attention.
That was a good PSA. PS. That's Melton's PSA. Not Pride.
That's okay.
Yeah. So this tool I used, I shared this data with the center, with my preceptor and the staff that I'm working with closely. And from there, we went step by step. And with that, the goal was to have 15 vendors for this event. And the vendors started accepting my invitations rather quickly. And I was really surprised. I told them my vision of what I wanted to happen. I went to specific community and service agencies, businesses that are in our local community off the information that I got from the needs assessment. And we're sitting at about just over 20 vendors.
That's amazing. Congratulations.
I'm at max participation, which is great. And every vendor that I'm looking at, their logos right here on this paper, they tie back to something from that needs assessment, whether it be healthcare, social connection, health insurance, veteran services, fitness. Some of the other items that were on there was technology, sleep. So some of our seniors have trouble sleeping.
Yeah.
When you have illness or chronic disease, that will affect your sleep as well.
Mm-hmm.
So in addition to our vendors that'll be around the room at the center for this event, I have some programming involved also. So I have 3 special guest speakers, and I told them I've got a limited time. I need you to do 10 to 15-minute presentation, down and dirty on the subject matter that you're the expert of.
That's why I wasn't invited.
One of my guest speakers is human factors and fatigue management specialist that I met through my Air Force career.
Yeah, that's amazing.
And she's giving a presentation that's titled, Get Your 7 to 9 to Thrive and Shine. So she stayed on.
Oh!
She's
clever. We like her.
We'll have Craig Rosen from NV Energy, and he'll be talking about ways that our seniors can save on their energy bill, things they could do in their home to reduce the bill. And then, of course, near and dear to my heart, we'll have Kevin Heward.
Oh, not him again?
Cybersecurity expert. And he's going to tell our seniors how they can stay safe while using technology, whether it be email, web, internet, or cell phones.
Yeah, so for some fun information for that, actually, I talked with your husband about it because I'm studying criminal justice. And we actually had a huge presentation of a FBI agent come to us talking about the rising crime of cybercrime, but it's one of the most rewarding and most dangerous crimes currently in the in the world, but in the United States. And so the target is senior people. That they targeting senior people, scamming them millions of dollars are being robbed by people who don't know how to protect themselves or being spammed by criminals, not just from the US, from all around the world, because they can call from anywhere, because we're living in the world of constant communication without borders. So
yeah, this community is extremely vulnerable, and I know that I have a limit of time for this event.
Yeah.
but I wanted to get the most the most packed in. So it might seem like a lot, but it's all thought out and it's special. So if I can tell the audience, if you're going to attend this event, if you're 50 plus, it's for you. 50 plus, any seniors, you're welcome to attend. It is specially tailored to our LGBTQ plus community. But any senior 50 plus is available to attend. We have a lot packed in. So we have the vendors, the 20 vendors that'll be around the room, and each vendor is so important. So it's not just like, oh, you got to go to these 2 or 3 vendors over here. No, if you're attending this event as a participant, each vendor is so important to say hello, learn what they offer, because they're going to bring some really important information. And it's not often that you get those excellent community resources under one roof.
Yeah.
So it's important.
But because that's thanks for you and your hard work. Finally, it's under all of those those organizations under one group.
In addition to the programming, the vendors, the refreshments, all of that's free. I was able to procure a little bit of a special event at the close of our event. So in the last 15 minutes, I invited one of our Las Vegas performers. He performs at Vegas, the show, downtown on the Strip. And he will be coming to do a special number specifically for our seniors.
Oh, that's awesome.
So
that's
I'm
awesome.
excited to...
Do we know who is the performer, or we can't say it yet?
We can say it. So the performer is Ray Winters.
Yay!
And you may know him from the Majestic Repertory Theater.
Yeah.
He's a lead actor in many of their productions. He's also a rotating cast member on Vegas, the show, and that's over at Planet Hollywood, I believe. But yeah, I'm excited to have him. It's funny, I reached out to him via email to invite him, and he says, "Oh, that's cool. You're talking about the seniors that are going to be going into their senior year, right, of high school?" I'm like, wrong senior.
No, not those seniors. The real seniors.
And he's like, oh, okay.
But that's amazing. I mean, like, you put together a really amazing event lineup for it, and something, but it's actually useful. And I love when something have a meaning, and this one is have a meaning for a community, but it's already underrepresented.
To what you're saying, the last thing I want to mention is before I finalized the plans, there was a veterans health fair that was happening at Palace Station, and it was last week actually, or 2 weeks ago, and I wanted to attend that as a veteran, but really to kind of gauge information and see how they were running things, and to go back and see how I was doing things. And as a participant at that fair, or that resource fair, I felt targeted by sales. People that were trying to make sales.
You almost freaked me the fuck out for a second. I was like, you get targeted. I was like, oh, okay. So back to the military being.
No. But the minute you walk into the event, they're hitting you with, oh, get solar, or here, the patio finished, or the lawn service. I'm like, whoa, this is like a resource fair. And I get it. Some things might be for sale. You might have some resources that have a cost, but you shouldn't have your participants feel like they're being pounced on the minute that they walk in the door. So what that showed me was that is not what we're going to have for this event. It's going to be the total opposite. So every single vendor there has a very important offering. Or
not
service.
For sale. Not everything for sale, people.
Yeah, nobody's.
We don't need to sell everything all the time. So I'm super excited for this event for our community. I think it's going to be amazing. And of course, thank you so much for all of your hard work. I mean, like, it's amazing what you do for the community, for an already underserved community inside an underserved community. But it's really important to take care of each and every one of us, because I think that's one of important mission of everything. Should be important mission for every single person at the LGBTQIA plus community. Try to not be selfish and take care of each other one way or another. And we need to do that. So public health, everything what you study, it's a public service. So your education, what you're trying to achieve here, and even this resource fair for our seniors, it's showing exactly the opposite of selfish. So your selflessness, it's that's how you say it? That was an English word? Perfect. Selflessness, it's amazing. And
I have a passion for it, so I'm loving what I'm doing.
And that we can tell, like you can tell when somebody likes doing what they're doing, not just for the money. Like when you are passionate about something, how you talked about it, this is really showing about the passion behind this project. So make sure you guys go out, make sure you guys check it out, share it with a person. If that person is an older generation who not gonna be able to achieve this podcast, just record it and send it to them one way or another. You can find them, you can talk to them, because that's important to be social.
The event is on August 13th. August 12th, you can catch me at Pride Bingo at Area 15. I will be a vendor table there.
Yeah!
Advertising the Thrive and Shine Senior Resource Fair. So be sure to be at Bingo.
Come to Bingo. It's going to be amazing. You guys the tables are always fun. Come, you guys can socialize. That's the social element. You can put down your phone. And I'm going to perform drag. So if you see me and you don't recognize me, that's because I'm not recognizable in drag. But you can see melodrama. So
Melodrama.
It's going to be awesome.
All right.
I'm looking forward to it.
Thank you.
But thank you so much for coming. We really appreciate you that you shared all of this information with us. And I really hope that all of this resource fair is going to be really popular. So let's push it much as you can. Share it, like it. I don't know, print it out, post it on your wall. Take a screenshot with it and post it on your Facebook, Instagram, TikTok, Grindr, Sniffies, whatever you want to do. Please share it with everyone you can, because we need to make this one successful, because we need more events like this. But please make sure you share this information. Please make sure that you tell much as people you can, because there are a segment of the community who needs help, and we are here for everybody. Eric is here for everybody. The center is here for everybody. So make sure that we are supporting each other one way or another. Go out, share some love each other for like 2 seconds, please, once a day. Like, just say hi to a random person. They're going to love it. Love you guys. Thank you.
Thank you. Thank you for the invite.
Thank you so much for being here. Love you guys, and see you next week.
Yoo-hoo.
Yoo-hoo.